Hello, I'm Father Michael Trail, Associate Pastor at Our Lady of Mount Carmel Parish in Lakeview. If you've been following the headlines, you know there is positive news concerning the coronavirus. Safe and effective vaccines have been approved for use. In fact, millions of Americans have already been vaccinated. It's a decision that can only protect your life, but also the lives of those you love. In spite of that, a large number of Americans are reluctant to get vaccinated. The rates of vaccine hesitancy are especially significant in the Latinx and African American communities. Joining us now to better understand the safety of the vaccines and why some may be hesitant is Dr. Whitney Lyn, a family medicine physician at Cook County Health. Thank you for joining us, Dr. Lyn.
Thank you for having me.
So why does getting vaccinated make sense, and how do we know these vaccines are safe?
So we know that one of the only ways for us to get out of this pandemic is to get this vaccine. We've been doing masks, we've been staying away, we've been social distancing for the last year. And it's helping, but it's not taking us where we need to go. And the only way to get out of this pandemic is to get this vaccine. They've done, many trials. We have already 2 that have been approved, now 3. And each trial one had 45,000, one had 30,000, and the last one, Johnson & Johnson, had 60,000 people that were in their trial. And so we know from their data that these vaccines are safe. We've seen already millions of people who are in the U.S. have been vaccinated and who have been safely okay. We haven't had any deaths for the people who have been vaccinated. So it makes sense to get it so that we can stay safe and we can now be normal soon. What's important is that these vaccines will help protect us from having moderate to severe hospitalizations from the COVID vaccine, as well as decrease of deaths. And that's the most important. In the U.S., we just passed the 500,000 mark of deaths in the U.S., and that is a number we shouldn't be at. But these vaccines can help us decrease that number as well as stop the number.
What do you think is causing the hesitancy in the African American community?
I think it's a great question, and there's many parts to it. One of the biggest is, past history of where a lot of African Americans have seen, the health disparities. They've seen, the past experiences with Tuskegee, but as well as, the social injustices, the political things that are going on in society right now, and that just gives them so much hesitancy of saying, are you coming after me again? And I think that's one of the biggest things that we have to address.
No, agreed, and that's we have to be mindful of our history. But what do you think is different about this time here today versus that hesitancy that was there in the past?
So the reason why I tell a lot of our patients that they should get the vaccine, the first set of people that could actually get the vaccine were frontline workers. And if they were trying to hurt any amount of people at that time, it would have been the frontline workers. It would have been us. And, I'm still sitting here today. And so I tell my patients, I've had it done. My mother's had it done. And we're all just fine. It's building that trust with your patients to let them know that if I can do it, you can do it. And also informing them of the various, even with these trials, the various trials. Many trials usually don't have a lot of representation of the Latinx or the African American community. And if you look at these trials this time around, they actually represented our population. 12% were used on minorities, and we did very well as a population. And so we have to realize that this time we were thought about, we were used, and that is the important thing that everyone needs to see, that they took into account us as well, and that's a great thing to know that we're moving forward.
Agreed, because even for me as a priest, I'm vaccinated myself, and I feel great. And it's just great for people like you and for me who are leaders in our community to be able to represent that we can show to others that it's safe and effective. One last question for you, Doctor, is what's the most important message that you want the public to hear when it comes to vaccine safety?
When it comes to vaccine safety, the most important thing is yes, this is a vaccine that all of us need. Yes, there are possibly some side effects, but I always tell my patients, it's better to have side effects than to die. I'd rather have a little bit of soreness, I'd rather have a little bit of aches and chills than to be in a hospital on a ventilator. And I don't know about you, but I'd rather go into church and see my colleagues and see my friends and family versus It's great to have the option to live stream it, but there's no better feeling than to walk into church and to be able to worship the way you would like.
Oh,
And this is
definitely
the
agree
only
with
way
that.
for this to happen.
Definitely agreed. Dr. Lyn, thank you so much again for joining us. Again, vaccination is a safe way not only to protect your health, but also to help get the COVID-19 pandemic under control. Also, as Catholics, it's important to remember that the U.S. Conference of Catholic Bishops, as well as the Holy See, have concluded that getting the COVID-19 vaccine is an act of love of neighbor and part of our moral responsibility for the common good. It's one of the most important ways to protect all of the lives of God's children. Thanks again to all of you for watching. For more information on vaccination, go to our website, archchicago.org/coronavirus.